think that we'll move on to talking about the current pressures and workload that community pharmacy are facing. So we do understand that these are very, very challenging times for contractors, pharmacists and pharmacy teams. And I just wanted to take this opportunity to provide assurance that the Community Pharmacy Provider Board, GMLPC colleagues and all the colleagues that work together on delivery of services here, we do provide regular updates and information to the GM Integrated Care System to ensure that your financial, operational and workforce pressures are being understood by the system. We've also engaged with MPs and have written to them many, many times over the last 3 or 4 years. And we also engage with Greater Manchester Health Watch to ensure that they lobby and support community pharmacy as a sector on behalf of Greater Manchester. So just in terms of some current work, we have got some work to develop GP and pharmacy interface working principles. The principles are agreed now, but we want to use this as an opportunity to work with general practice colleagues and the ICS to develop understanding, save you time and reduce the administrative burden that you're facing. I've just written a paper on addressing medicine shortages to raise awareness of the challenges that you have to get the medication supply, how it impacts patients, and what is it that GM Greater Manchester can do to help us. We're also in the process of developing some workforce schemes to support recruitment, retention and well-being. For example, we're looking at apprenticeship schemes. We're looking at collecting primary care workforce data so that we can actually put a business case forward to help fund any courses and actually support recruitment through fairs, etc. And we've also recently started a project to roll out access to the full GM care record, which will allow read-only access to GP and hospital records to save time and find information easily without you having to contact other healthcare professionals in the system. Next slide. So in terms of well-being, I have spoken to many of you over the last few months, as of my colleagues are on the call, and we understand that it's a really critical time to support you with your well-being, particularly your physical and mental health and well-being. So Community Pharmacy Provider Board have acquired access to a suite of health and well-being resources now for pharmacy teams alongside wider primary care. We have just developed a one-page infographic to make it easy for you to access that information and whatever support you need. You can contact pharmacist support for advice, and also the GMLPC team have now completed the mental health first aiders course to enable us to support you better in these challenging times. Next slide, thank you. So in terms of the workforce wellbeing support, again, we will share this offline and I will put a link in the chat, but you can see there's a range of free and confidential resources now available to support you. We start off with crisis support, which is the immediate support that you might need should any of you or your colleagues be suffering mentally or require immediate assistance. We've got an NHS staff mental health hotline. There's a resilience hub. We've also got a toolkit that you can use with your pharmacy teams. There's a self-check tool. There are downloadable apps that are free for you to use now. There's also look after you coaching support. So if you want something a bit more long-term, then you've got that access now to that sort of support. We've also got financial wellbeing, cost of living support advice, and also just the general rest, rehydrate, refuel, and general guidance and tools that you can use with your pharmacy to make sure they stay resilient and stay well. We understand that it is very pressured on a financial basis. We understand operationally it's challenging. We also understand that this has a severe impact on the workforce attrition as well. But we are working really hard on your behalf. So we ask you to take the following into consideration, what we're going to talk about today to help you remain sustainable. Next slide. So just as a starter for 10, that's what we're trying to do for you. But what can you do to help yourselves and help your teams? It's really important to start planning your workload with your team now. I mean, the priorities are numerous, and we know that you're challenged with many, many different priorities every day. But it's really important to ensure that workload is shared with members of your team. Talk to someone if you need support or help. It's really, really good to talk. It's really good to get things out of your system. If you need to talk to the LPC, please contact us if you want to speak to someone in your team, or you can access the wellbeing resources and numbers that we provided to you. Make sure you keep adequately hydrated, make sure you get a good sleep, make sure you get fresh air and exercise, and take time every day to do something to relax. Self-care is really important. We need to ensure we're all checking in regularly with each other to check how everyone is coping and feeling. And talking with someone who listens is a rapid stress reliever and improves well-being. Thank you very much.